Good afternoon. My name is Dr. Mari Kurahashi, and I'm a child psychiatrist in the Department of Psychiatry and Behavioral Sciences at Stanford. I co-direct the Stanford Parenting Center with Dr. Elizabeth Richer. I'd like to begin by thanking everyone who has joined us today. We are in especially challenging and busy times, and your dedication to parenting is evident, and you're taking the time to join us for this webinar today. Before we get started, for those who are part of our School of Medicine community, our continuing medical education colleagues have worked hard within a short time frame to make sure webinars such as this one are eligible for CME credit. Instructions on how to receive CME are listed on this slide and will be listed again at the end in the chat. Next slide, please. Today's webinar is the third and final of our Fall-Winter Positive Parenting During COVID-19 series hosted by our department and spotlighting some of the incredible members of our Stanford Parenting Center team. If you would like to view our previous webinars or revisit them, please note that all of our webinars are recorded and available on our website listed here. We'll have another Spring Positive Parenting During COVID-19 webinar series, so please stay tuned. We'll also be sending an email following today's webinar with this information as well. And in addition, we have an exciting new resource to share with you. We're now offering a more personalized resource for parents, what we're calling our Positive Parenting Consultation Groups. These small groups are designed to build on the information provided during our webinars and provide additional parenting education and scientifically based parenting tools to support your child or adolescent. If you're interested in this group, please look out for an email following today's webinar to learn more. Next slide, please. So now let me just reiterate a warm welcome to everyone who has joined us today for our webinar, Navigating Screen Time During a Pandemic. The emergence of the COVID-19 crisis has had a sudden and profound impact on families across the world. With the increase in stressors, fears, and uncertainties, caregivers are reporting a substantial impact on their own mental health and that of their children. Our world has undergone tremendous change over the past year and continues to do so, and we have all been forced to reimagine our roles and do things differently. Managing screen time is just one of a multitude of changes families have faced, as our children are consuming more screen time than ever before with distance learning and coping with social distancing. As a result, it is more important than ever to bring our attention to the emotional health and well-being of our families and supporting caregivers in this new terrain of managing our children's screen time use is one step in that direction. Caregivers, we see you and commend you for all that you've done and continue to do, and we hope that today's webinar provides a boost in your confidence by offering some additional tools to continue this journey. With this webinar, you will have a better understanding of the effects of screen time on the development of children and adolescents at different ages, as well as the effects that the COVID-19 pandemic has had on screen time for youth. You'll also be learning strategies to help children and adolescents use screen time in healthier ways. We are so fortunate to have Dr. John Leikauf and Dr. Sabrina Ali-Leger with us. Dr. John Leikauf is a clinical assistant professor in the Division of Child and Adolescent Psychiatry here at Stanford. His clinical work and teaching focuses primarily on helping individuals and families with disorders of attention, anxiety, and disruptive behavior. He is the recent recipient of an NIMH Career Development Award to study the use of multiple diagnostic measures, including computerized assessment tools, to bring more personalized care to youth with these clinical presentations. He is also the grateful father of 2 daughters, and I can attest to how adorable they are. Dr. Sabrina Ali-Leger is a child and adolescent psychiatry fellow at Stanford. She has been working with youth and their families in our general and mood clinics, and she is also an active member of the Parenting Center. Dr. Leger has a special interest in young child therapies and positive parenting interventions. We are so lucky to have them with us today. Additionally, we're also very fortunate to have Mindy Hamke, who is also here with us. As she has been throughout our entire webinar series, Mindy has worked incredibly hard behind the scenes to make this all possible, and I just wanted to further extend our gratitude to Mindy. And we'll begin the webinar with the presentation and have time for questions afterwards. Please submit your questions through the chat function located at the bottom of your screen. And now I will turn it over to Dr. Leikauf and Dr. Leger.
So thank you again, Dr. Kurahashi, for the introduction, and to all of you for joining us today as we explore this topic. Screen time was already something that was being discussed prior to the pandemic and has become all the more relevant over the past 10 months. Next slide, please. So these are perfect, thank you. So to start off the presentation, I wanted to take a look at the guidelines that were in place prior to the pandemic. At the time, studies were showing that on average, children ages 8 to 12 would spend approximately 4 to 6 hours on screens every day, whereas teens would spend up to 9 hours per day. The general recommendations were to really limit time for kiddos below the age of 18 months to video chatting, adult present. For kiddos between 18 and 24 months, to perhaps start introducing educational programming with a caregiver. However, again, with limited use of screen time. In 2 to 5-year-olds, the recommendation was 1 hour of non-educational material on weekdays with up to 3 hours per day on weekends. And then with children 6 years and older, to focus on healthy habits and try to limit screen time as much as possible. Next slide, please. Before diving into how things have changed with the pandemic, it's helpful to understand how our brains interact with digital media. Dopamine is a chemical produced in our brain that plays an important role in motivating behavior and gets released by engaging in pleasurable activities, such as taking a bite of that delicious cake or purchasing something you really want. It's released after exercise, and importantly, it's released when we have successful social interactions. It rewards us for enjoyable behaviors and motivates us to repeat them. There are multiple dopamine pathways in the brain, and they correlate with cognitive processes that are largely responsible for behaviors associated with learning, habit forming, and addiction. The pathways over time can even become activated when we're anticipating experiences that are rewarding, and in particular, reinforce the association between a specific stimulus and the gratifying reward that follows. Every time this occurs, the association becomes stronger. Studies have shown that rewarding social stimuli, such as laughing faces, positive recognition by peers, and messages from loved ones, activate these dopaminergic pathways. Social media has provided an unlimited supply of social stimuli, which can be both positive and negative. Every text message, like on Instagram, or shout out on Facebook has the potential to be a positive social stimulus that leads to a dopamine influx. This same process occurs as you try to beat that next level of your favorite video game or try that new round on Candy Crush. Winning the level triggers a rush of dopamine that further strengthens the association that this activity is a pleasurable one. Research in reward learning has uncovered that with this strengthened association, you don't even need the positive reward to experience the dopamine hit, but over time, you will start to experience the influx by simply engaging with the cue for that reward. You don't need to see the like on Instagram, but scrolling will trigger a release. In addition to this very typical physiological response, virtually all games and social media work on a variable reward system. This is precisely what you get when you go to the casino and pull a lever on a slot machine. At some point, you know there's going to be a big payout, but the amount of time between payouts is random, and the number of times you need to pull the lever to get to that reward is also unpredictable. What makes this type of reinforcement so effective and challenging is that people end up learning the behavior really quickly. And because the positive reinforcement comes so randomly, the rate of getting rid of the behavior is incredibly slow. If I post just one more picture on social, I'll get those likes. If I try this level just one more time, I'll beat it this time and get that reward. Next slide, please. There's still a lot about the effect of the pandemic on screen time that we don't know. Like many aspects of COVID and shelter in place, not enough time has gone by for there to be robust research studies. However, we do know that preliminary data suggests that there has been up to a 60% increase of screen time in youth. Digital game distributors are reporting major increases in daily users, measured in the millions. Kiddos have had to adjust to engaging in a new way of learning that is mostly centered on the use of screens. Due to shelter-in-place ordinances, there's been a major reduction to in-person social engagement and a subsequent desire to socially connect via online experiences. And lastly, there's been a notable reduction in activities outside the home, with a natural increase in screen time to replace those activities. Next slide, please. However, it is important to note that not all screen time is created equal. Some of it may be passive, such as binge watching TV or scrolling through social media, without actually recognizing what you're looking at. However, there are also interactive, collaborative, and creative ways people are engaging with digital media. Kiddos are making music on their computers or creating graphic art. They're playing video games with their friends and developing pro-social behaviors, such as working in teams to reach shared goals. They're connecting with grandparents over video conferencing platforms and hopefully continuing to build the foundations for lifelong relationships. And of course, although there are definitely challenges, they are learning and growing their cognitive skills. Next slide, please. There are many benefits to digital media, with clear evidence that digital technology can be beneficial for children's social relationships and in helping to build a community. Not only by staying in touch with others during this socially distanced time, but also by finding peers and communities where there are shared interests. Literature suggests that no use and excessive use of screens can actually have a small negative impact on mental well-being, whereas moderate use can in fact have a small positive impact. Unfortunately, there is no clear data that helps us define what excessive use looks like. But there are guiding principles that we can use, and I'll get to those in just a moment. Digital media also allows for a wide variety of educational resources. If a kiddo is interested, it is definitely out there for them. It can foster independence, creativity, and the opportunity for exploration. Next slide, please. But as with most things, even good things, there may also be associated risks. There is the possible risk of engaging with harmful content or information that is inappropriate at a child's developmental age. There may be adverse experiences such as violence, risk-taking, sexual content, negative stereotypes, or cyberbullying. There are concerns for impaired sleep since screens can overstimulate and distract. Blue light can delay the release of melatonin that affects the circadian rhythm. People worry about its effects on development and learning, that screen time interferes with the important experience of boredom, which can be an amazing trigger for creativity and imagination. There have also been studies that have demonstrated a correlation between increased screen time and obesity, with frequent use of screens in preschool-age children being linked to weight gain. It's important to note that there are a lot of fears about the potential negative effects that media has on children and teens. However, a lot is still unknown. And a lot of the data we have so far, because of the way the studies have been conducted, are correlational, not causation. We don't have good longitudinal studies to see how engagement in digital media affects kiddos over time. And this distinction is an important one. Let's take obesity for just a moment. Although there has been a correlation between increased screen time and weight gain, there have also been other observed behaviors that make this more complicated. For example, researchers note an increase in binge eating behavior and a decrease in physical activity. What this suggests is that screen time may affect other behaviors that are related to negative outcomes. The reason why this distinction is important is so that we try and address the underlying issues that will allow us to better support the needs of our particular child. Next slide, please. So there are wonderful benefits to digital media. There are also multiple possible negative effects that we're still really in the process of trying to understand. So in true Goldilocks form, how do we find the balance? How do we find just right? Next slide, please. A place to start is by having a conversation and getting a better understanding of your kiddo's relationship and engagement with screens. Each person is going to be different, and we want to get a sense of what is going on for them and what function is screen time serving for them. So I'm going to ask you to go back to basics with the 5 W's and how. Be curious. Ask questions such as, who are you engaging with online? When are you using digital media? Is it disrupting other tasks? Where are you using screens? Does it interfere with sleep? What's the content? What are you doing on digital media? What do you like about it? What are you interested in? Why are you online? Is it to learn, create, engage, or is it to distract? I want to focus on 2 particular questions as we think about this balance between benefits and potential risks. What are you not doing as a result of the time you're spending online? And how do you feel or act after using digital media? Next slide, please. Let's focus for a moment on what activities might be disrupted by engagement with media. There are a lot of activities in a kiddo's day. This is an average template, but please feel free to swap in and out the activities that are relevant for your child. So for example, replace school with daycare or for younger kiddos. Each activity has its own aim and purpose. If media starts taking up a larger part of that 24-hour day, is it replacing something? And if so, what is it replacing? Has sleep gone down from 8 to 5 hours a night? Is there less time for homework, so it's not getting completed? Has physical activity completely gone out the window, especially during the pandemic when there are additional difficulties in going outside and finding a safe space, and with team sports being put on hold for many children and teens? It is important to think about more than just the activity of engaging with screens, but how it relates to the larger picture of a kid's day. Next slide, please. I want to highlight these particular activities because we know that they are protective and contribute to a more positive mental well-being. Getting us enough sleep, eating regular meals of a healthy diet, and getting daily exercise are all important for our mood, energy, ability to engage, and furthermore helps to bolster our resilience. Playtime for young children, teens, and I would even say adults is incredibly important. It obviously changes over development, but play is a way for kiddos to process what they are going through, explore the world, improve their cognitive skills and decision-making, work on pro-social behaviors like turn-taking, and even learn self-regulation. Family time is another important factor, and maybe the hardest to prioritize during this pandemic. Parents are stressed. They have been placed in an incredibly difficult position where they're being asked, sometimes simultaneously, to play the role of employee, parent, teacher, and peer for their children. It can then be really challenging to then, after a long, tiring day, to make time for engagement as a family. And at the same time, there is really good evidence that family time and family support are strong protective factors against adverse outcomes. Family time can look like a variety of different things. It could be dinner time where everyone puts their screens away and engages. It can be reading bedtime stories with your toddler at the end of the day. It can be playing a favorite board game to unwind. It could be whatever works for your family. And in this process, create a safe space that is invaluable to your child. So at the day, it's really about finding the balance. If your kiddo is able to manage a full day by relatively keeping up with schoolwork, social engagement, and quality time with family. And it's fairly good physical activity, sleep habits, and eating. But they're getting extra screen time, or you need to have them watch Frozen one more time while you're finishing work. On the balance, it's more than likely okay. Give yourself permission to prioritize what is most important. Next slide, please. Going back to our initial questions, there are two others that I want to highlight, which are why are you using digital media and how do you feel after using it? There's a nifty little tool that can help us answer these questions by keeping a log of what's going on. A nice acronym is ABC, which stands for the antecedent, the behavior, and the consequence. And there are two ways to use it. First is to understand why or in which circumstances is digital media more frequently being used. So for example, the behavior is that you reach for your phone. When this happens, take note and assess for the action or response that occurs directly afterward. For example, perhaps what you notice is that multiple hours go by scrolling on social media. You also want to pay attention to the events, actions, or circumstances that occurred immediately before the behavior of reaching for your phone. You might recognize that it was boredom that seemed to trigger it. When using this method, not any one particular circumstance or log entry is important, because over the course of a day, there can be a variety of situations that arise. However, this method is most helpful in uncovering patterns that seem to lead to an ineffective use of digital media. A second way to use it is to try and understand how you feel after using it. For example, perhaps the behavior you want to track is hours of gaming. You notice that before playing the video game, kiddo seems to be in a good mood, engaged, maybe even helping out. However, directly after the activity, she is sullen and irritable. You may even notice that there tends to be more conflict in the home right after video game time. Again, by tracking this over time, you can really start to see a pattern, and if so, hopefully address it more clearly. I also encourage you to ask your kiddo if it's developmentally appropriate to join you in this process and have it be something you do together. Next slide, please. So what do we do if there are concerns? Dr. Leikauf will be talking a bit about kind of post-interventions or strategies that can be used after we recognize that a problem has developed. However, I want to spend a few moments to talk about prevention. It's often a little easier to set the parameters or rules before getting started than trying to figure things out afterward. A great resource is by the American Academy of Pediatrics, which is the Family Media Plan. You can download it for free. And it's a resource that walks families through the type of media plan that works best for you and your family values. Another strategy is to determine what the plan is going to be when introducing a new device. For example, a lot of kiddos got new devices over the holidays, which can be an opportunity to have a conversation about the expectations regarding the use of this device. How is the device going to be used and when can it be used? It's also important to discuss developmentally appropriate supervision, with privileges increasing as your kiddo demonstrates appropriate use. In this conversation, kiddo frequently has a different perspective on when and how much a device should be used. So for example, I'm going to role play a little bit. Patrick, I hear that you want to play on your iPad for 4 hours every day. And I was thinking that about 1 hour would be more appropriate. Let's find a middle ground of 2 hours for now. But this is an ongoing conversation. If everything is going well and you're keeping on top of your schoolwork, doing your chores daily, making time for your friends and spending time with family, we can definitely talk about increasing the time. However, if these other important parts start slipping, we'll have to reduce the iPad time. Engage in collaborative problem solving with your kiddo and be clear about the reward and consequences from the beginning so that everyone is on the same page. It might still be really difficult to put that device down, but at least everyone is working with the same expectations. Next slide, please. Again, I do really want to reiterate how hard it can be to put digital media down. It's designed to be this way, to set off dopamine in our brain and hold our attention. There are significant financial incentives for social media and video game companies to increase daily use. And so, especially for our teenagers, it can be helpful to have this conversation with them about what's going on and how these devices do what they do. More general strategies that can also be helpful to implement at home are taking kind of 10-minute breaks between online classes and encouraging some movement or stretching, turning off screens an hour before bed and removing devices from the bedroom to really foster healthy sleeping habits. Support kids in turning off their devices. An alarm can be set to provide a time warning that their device needs to be turned off in 5 minutes. Or instead of waiting until the designated turn off time, about 15 minutes before the device needs to be turned off, go and check on your kiddo to see where they're at and look for a natural break. Let them know that they have time for one more level before having to turn off the device. Finding a natural breaking point can facilitate an easier transition when turning off the device. Having a routine is always helpful, as well as familiarizing yourself with age-appropriate content. Common Sense Media is a helpful resource since they assess video content for developmental appropriateness. Next slide, please. There are also some collaborative strategies to implement with your kiddo, such as increasing family time, which can look a variety of different ways, and we talked about that a little bit already. Discuss digital media citizenship with your kiddo. This is an ongoing conversation, and it can be important to talk to your child about how they might respond to social messages that are scary, mean, or inappropriate. Have these conversations in the same way you would discuss similar issues that are happening on the school playground. Discuss what is appropriate online behavior and encourage them to use their own critical thinking. Lastly, we can support kiddos by helping them to create replacement behaviors. Going back to the beginning, engagement with digital media is serving a purpose. Sometimes it can be positive, while other times leading to more negative situations. However, it is really difficult to stop a behavior without having something to replace it with. If I'm using social media as a way to connect, if I reduce the amount of time I spend, I'm still left with the desire for social connection. And so it can be helpful to find other ways of addressing that same need. And this is where parents can support their children by brainstorming and thinking through what some of those other options might be. I'm now going to pass the presentation to Dr. Leikauf to talk about how screen time has affected parents too. Next slide, please.
Thank you, Dr. Leger. That was wonderful. Just letting that sink in for a second and certainly thinking about things I can use myself in my family. I wanted to start with this screenshot. This is from 2001, A Space Odyssey. If anyone still remembers that film. You know, a couple things here. One, I wanted something from an older movie just to highlight that concerns about screens are not necessarily anything new. We're talking a bit about the pandemic and what's different this year, but many of the strategies that we're really talking about today are really kind of going back to first principles and things that we have known work. We're going to talk a little bit about adapting to the pandemic. The truth is there isn't a lot of evidence for specific adaptations in terms of screen time. What we're seeing, what we're hearing, what I think is just true in the situation is that everybody is adapting. Everybody has new options. They often don't feel as good as the options that were available last year in many ways. And we're having to make choices that involve trade-offs. The other thing I think that this kind of highlights is, you know, this is the astronaut at the space station in the beginning of the movie, after the early part with the apes, which I never quite understood, but he's using screens to connect with his family at the beginning, which is really magical. I mean, he's in outer space. I think it has sort of felt that way for many of us. Screens can be a social lifeline, not just to family, who may be far away or friends who may be far away, but even to friends from school and neighbors and people who geographically are close to us this year. Of course, the film also has Hal at the end, and I think highlights some of the conflicts that we feel. How are we in control? How are we not in control? What are the screens doing to us kind of behind the scenes? Is this, and those are things that we're all dealing with. So next slide, please. So we're going to talk about a little bit about general principles for effective behavior change. And just to kind of get this out of the way at the beginning, I'll talk more a little bit about COVID in a couple minutes, but we have a kind of a culture of individualism, I would say, in the United States. I think that in many ways is a strength. I think in situations like this, sometimes it can lead to self-blame or shame, and I want to just put that on the table and then maybe clear it off the table. This is not about anybody's fault. This is about all of us trying to do our best. And one powerful tool we have as parents is ourselves. We know that in addition to the operant conditioning principles that Dr. Leger reviewed so helpfully for us, and that are certainly at play with digital media, and that can be sometimes also used for good, let's say, by parents. Children also learn through the example that we set, social modeling. This is true for all of us, continues to be true, but the relationship between a parent and child is always at the core and always the most important. Psychologists like Albert Bandura and Peter Fonagy have talked about the importance of social modeling, and Fonagy talks about epistemic trust. Those specific others, it can be a caregiver attachment relationship early in childhood. But as we get older, it tends also to be other people in our culture, some of them accessed, frankly, through mass media, right? Whether TV, social media, but also people that we interact with in real life. And so, children really do pay attention to and learn from us as parents how we interact with screens. So this is occurring consciously and unconsciously. The point there is not to expect that this is something that we're necessarily going to be fully aware of ourselves, or that our children are going to be able to articulate, but that are important nevertheless. Next slide, please. So just to emphasize the empowering message here, parent media use has been shown as one of the strongest predictors of children's media use. What we do with screens, as in everything else in life, makes a very, very big difference for our children. It doesn't mean that they're going to copy us exactly. That would be easy, but also boring. But it is something that we can address, and something that we can do something about when so many things feel out of our control this year. Next slide, please. Just to address the issue of defensiveness, we often notice this in others and notice this in our children, but I notice this in myself too. I'm probably not the only one. Just thinking about, hey, but I don't have a choice, right? What about work? I mean, I'm on my screen all day. Does that really count? I use screens for all kinds of great things. We call grandparents, we call friends, look up recipes, figure out how to keep my kids safe. What are the latest COVID guidelines? School going to be open or not? Where to wear masks? Exercycle TM, not to, we don't want to endorse any brands here, but many people get exercise videos through screens. We read, all kinds of enriching things. So, just to reflect, I think, as Dr. Leger said, we all, as our children do, we do too. We all have our reasons, and not all screen time is the same. But I think as we kind of reflect on ourselves and what comes up, it's easier to have empathy for our children and think about it more from the point of view of, okay, how is this maybe a tool to get certain needs met? And then also, after understanding that, what might be some of the negative consequences. So again, antecedents, behaviors, consequences, or, with screen time, I think of context. What is the situation? What is the need that needs to be met? What time of day? With whom? what is the specific content? Again, not all screen time is the same. So what exactly is being consumed? And then what are the consequences? And assume that there are going to be probably positive and negative consequences of most of these. And all those are important to take account. And as Dr. Leger said, not just the consequences of the use itself, but what is not happening as a result. So I just want to encourage all of us to strongly consider taking a personal inventory before asking our children to change. You know, this is in terms of behavior change. There are a small number of people who respond. It's probably on the order of kind of 15 to 30%, certainly it's less than 50 from the research that I've seen. When we tell people it's a good idea to change your behavior, and this is, you know, mostly sort of doctors with their patients, the research that I've seen, but I think this applies, at least in my experience, you know, as parents as well. When we tell people, you know, I think you should change your behavior, here's why, you know, you're smoking could cause cancer, that could kill you, that's not so good. Yeah, you know, maybe 15 to 25% of people will make a change, and for some people it will endure, but for most people that's not enough. And I think it's a good way to look at it when we're thinking about asking our children to make a change. If we have concerns about their screen time use, they may or they may not as well, and they have some reason that they're doing the behavior. And so in terms of helping guide them through and being realistic about what may be needed for most people to be helpful, we want to think about the tools that we have. So modeling is one of them. Next slide, please. And again, the empowering message is that what we do counts. Okay, so in thinking about self-assessment, want to encourage self-reflection, but also self-compassion. Again, this is not about judgment or blame or shame. If you're feeling those things, okay. Yeah, you know, I would encourage acceptance and moving forward. I'm certainly not trying to bring any of those. Again, we all have reasons that we do the things we do. We're doing our best at any given moment. And, you know, we're in challenging situations, especially this year. But just, these are some questions just to kind of start the ball rolling and get you thinking, certainly not exhaustive, but just to try to think, you know, openly and honestly, what were my screen time habits before COVID and what are they now? How have they changed? How may they have changed over the course of the last year? And then start to think about why. So, you know, when going through these exercises, something that often comes up is like, well, there are a lot of factors I don't really know, you know, and that's okay. We don't have to know for certain. The process of just thinking it through and trying to understand is usually very helpful. And sometimes really important connections emerge. Again, just some questions to kind of get the juices flowing. What needs or wants am I meeting with screens? What about my use is consistent or is not consistent with my values? What are those values? How did I learn to use screens the way that I do? How did I pick up these habits or coping strategies that I'm using? And has my ability to get my basic needs met changed throughout the year? For many of us, that's the case. And for many of our children, that's the case. Next slide, please. Some benefits of self-reflection, whether or not it leads to behavior change. Again, self-empathy, self-compassion, and from there, potentially a deeper understanding of our children. We probably have good reasons for doing what we do. I think that's just a core message I want to keep emphasizing here, and so do our kids. But that also doesn't mean that there isn't potentially a better way. By performing this sort of self-reflection exercise, whether we verbalize that to our kids or not, and of course, I wouldn't necessarily encourage kind of airing it all out there. But kids will see that, you know, if our attitudes change and they have a sense that our behavior changes too, we're directly modeling healthy behaviors in the process, which is just as important: the problem-solving strategies, emotional honesty, and openness, bravery, integrity, leadership. We can, you know, if we show we can walk the walk, we're in a much better position to teach and, you know, potentially ask for change. Even if it leads to an effort at change, whether that effort is successful or not, kids see that we're trying and they see the grit that that takes, and many other things besides. It's just to highlight a few. And then there are benefits for the relationship, which in and of itself is one of the most important tools for, or just one of the most important things for our own and our children's mental health. And certainly any attempts we might make at changing incentives, limit setting, which we'll get to, but are going to be much more effective standing on a foundation of a good relationship with your child. And of course, that probably is already there, but particularly around screen time use, if we show that, you know, we're thinking about this ourselves, we're in a much better position. Next slide, please. Sometimes what comes up, and again, acceptance, this is okay, this is normal, is doubt about whether or not I can make a change. First of all, I just want to say, believe in yourself. Maybe you can, it might feel hard, you know, start small, but just see. But, you know, sometimes acceptance and self-compassion is really what we need with this. That's okay too. You know, I think processing the negative feelings allows us to see how hard it is for all of us to change. And then that gives us much more space for self-compassion, and from there, empathy for our kids, a better emotional connection, and likely more realistic asks of them, which is going to lead to more success in attaining healthier screen time habits for the whole family. You can do it. Even thinking about it is an important step, is I guess the message I want to deliver here. Next slide, please. In this context, thinking about what's different with COVID, you know, some people have written some editorials about this. The truth is there's no kind of scientific evidence-based, you know, this is the difference with COVID in terms of screen time, and this is what you should do, sort of prescriptive solution here. But I think just wanted to spend a moment just acknowledging some of the things that have come up for me and people I've worked with, people I've talked to, families I've worked with this year, and just to kind of acknowledge some of this. I think it's been helpful in understanding ourselves, what we're going through, also understanding our children. And again, this is important when asking someone to make a behavior change. Normally we would say, you know, don't pick a time when you're under a lot of stress to, you know, whatever, quit smoking, give up screens, try a new weight loss program. Pick a time when, you know, other things are sort of stable. You have energy to devote to this. It's going to be a lot of work. It's going to be hard. We're changing the reinforcers. You're going to have probably some negative feelings, some days when you don't feel up to it. And you're going to need a lot of time and energy to kind of devote to this. That's not the case this year. So just acknowledging that in the first place, this may or may not be the battle that you can fight right now. You know, I think not to spend too much time on this, but really just to acknowledge this is a really big deal, what we're all going through. Many people are dealing with death, permanent disability, social isolation, lost instruction time at school, economic devastation, people losing their businesses, jobs. This is very widespread this year. Everybody's suffering in some way, but it's also very uneven. And that's hard in and of itself. Fear, feelings of loss, anger, guilt, moral injury, these are normal right now. These are healthy responses to a situation that is awful, frankly. We all cope differently. So just encourage, kind of before trying to make the behavior change, again, understanding what purposes our current coping strategies are serving for us and for our children. And just be curious, how am I coping? How are my children coping? Maybe screen time is just a way to check out for 45 minutes and not deal with all this. You know, maybe that's not the worst thing in the world. You know, 8 hours might be a little bit hard to do school and those other things, right? So thinking about balance, but just understanding, again, how we all might be coping differently with the trauma that this year is bringing for us. Just to be sensitive to the fact that when the trauma is still sort of in process, it's very common for people, for all of us, to compartmentalize, not necessarily be able to process that all at once. Each of us is probably at a little bit different stage, and that doesn't necessarily proceed in a linear way. So, you know, we might be somewhere in May and somewhere else in June, somewhere in the morning, somewhere in the afternoon, and our kids as well. So I'm getting a time notice. Okay. So I'm going to move on, but just to acknowledge this is really hard. Be interested in how your children are coping with it, how you're coping with it. Next slide, please. I'm going to have time for all the important questions that we're going to have. One really big thing that I think we're all probably aware of, but maybe doesn't get talked about enough, age seems to be the biggest risk factor by far, at least in the mortality risk. There's a lot we don't know about potential morbidity risk. They really don't have great data for those sort of things yet in terms of long COVID. Is that a big deal or not? Not getting into that, we don't know. But in terms of mortality, it's about 1,000-fold for somebody over 85 compared to under 18. So that's really, really different. And the things that we're asking our kids and teenagers to do this year are different. And the way they're going to be reacting to this is going to be different than how we're going to be reacting. Many of them are going to see this as making a sacrifice on behalf of others. And so anyway, they're also great observers of us. I just want to make that point. But they often don't have the context that comes with age and experience and notice sort of specific, maybe even kind of extreme or black and white examples. We've all had to adjust our expectations. That in itself brings a grieving process and a feeling of loss. Very few of us are operating our best. Please just try to be kind to yourself and your loved ones right now as you're going through thinking about screen time. Next slide, please. Again, the relationship is so important. Be curious. Children learn more through interacting, especially young children, with their caregivers around screen time, being able to ask questions, get feedback, guidance, and what we call scaffolding, helping to see where they are and supportively take the next step, or whatever that is. So consider as much as you can consuming the screen, media together when possible, and be interested. Be as genuine as you can be. Ask them to teach you about what they're doing. Obviously, your child is unique and as age appropriate. Next slide, please. I'm going to try to get through this part as quick as I can, but this is moving on to the next part. Okay, limit setting. What if we have already entered the vortex? We've been sucked in. It's clear it's too much. We've thought about all this stuff. Again, just to highlight, there was a recent article at Times, and Professor Humphreys here at Stanford was talking about using the addiction model. I think a really important concept that I want to mention is bundling. When there are multiple, so food, social, whatever, visual, potentially exercise, but whatever they are for any of us, multiple reinforcers kind of connected together. That's also going to really contribute to maintenance of a behavior. And that's often the case. But if there are any things you can unbundle, so not necessarily pairing snacks, doesn't have to be an absolute rule, but just think about things like that. Next slide, please. Okay, before trying to change, again, reflect, understand. Have I set an example I'm comfortable with? Do I have one-on-one time with my child? That's play for younger children, more verbal for older children. Do I understand why they're using screens the way they are? Have I validated their feelings based on a shared understanding of their feelings and needs? And am I still pretty clear that there are significant negative consequences of the current pattern of use? Then maybe it's time to start with the next step. So again, start with a conversation. Maybe skip over this in the interest of time, but just start, basically be interested. Don't start with, it has to change. Start with, I'm interested to know, neutral observations. This is my concern. This is how I feel. This is what I think about it. Take ownership of your perspective, our perspective. And don't assume that your child's going to agree with you, but give them a chance to voice, again, age appropriate, in an age appropriate way. Next slide, please. After that first conversation, you may find you need more information. There may be new things that come to light, or you may still be very sure. Clearly state your concerns about the consequences. Again, take ownership, but see if you can identify a shared goal. Often around a value, something can be identified. Maybe that's connecting with friends. Maybe that's gaining independence and going to college. Whatever it is, see if you can problem solve together. Again, I'm kind of going fast here to get to the questions. Next slide, please. If you can, great. You can work together on identifying solutions. Remember, screen time is a privilege. I'm saying that to be empowering to you as parents. You probably do have more control over it than it might seem in the moment. It doesn't necessarily need to be held over your child's head constantly, and we generally advise not keeping, having the punishment, which removal of a, we would think of that as, something that's rewarding. We think of that basically as a punishment. Don't hold that over your child's head, and constant reminders, or kind of make it in the moment, but ideally have that clear and consistent in advance, and something that's kind of laid out when the iron is cool, as we say. Next slide, please. And then just general tips for limit setting. Give advance warning. Positive reinforcement works really best when we're trying to learn a replacement behavior. See what you can identify. If you've collaborated, that's wonderful. You may have to suggest some things. It's much better to offer that alternative and maybe even reward that alternative rather than trying to punish the existing behavior away, because the need's not going to be met. And we're just hoping that the punishment is more severe than the reward that they're getting. Keep punishments short, not too harsh, punitive. Be united, stay calm, don't negotiate in the moment. Expect your child to be upset. That's okay. Allow their space. Don't try to control their feelings about it, and don't expect perfection. Anticipate relapse and 2 steps forward, 1 step back kind of progress. Again, plenty more to be said. You can always consider consulting with a professional if it doesn't seem to be going well. Just trying to give some basic tips. Okay, thank you.
Okay, well, thank you so much, Dr. Leikauf and Dr. Leger. So many helpful takeaways for myself as well, and applications for my family. Just want to squeeze in a few questions here, starting with someone said, I have a child who has ADHD, and he becomes really upset when he's asked to turn off screens at the end of the day. We've tried to set limits, but he starts shouting, screaming, creates a lot of issues at home. What can we do?
That's a tough one. Dr. Leger, I'm sure you have some thoughts too. I just say, not knowing your child and age and so forth, and exactly what you've tried. And I think what I would say in general, we do see for people with ADHD, often emotion regulation not always, but can often be more of a challenge than peers the same age. So those kind of storms sometimes are part and parcel of setting limits. In terms of trying to minimize those, they're often more sensitive. And again, ADHD is heterogeneous, so I don't want to say too much without knowing your child. But for many people with ADHD, they are very sensitive to rewards in the moment right now. And it's harder to balance that against kind of future rewards, which is often what we're asking them to do when we're making a transition. Things like warning really helps, but it's, again, not always going to be perfect. Think about, can there be replacement behaviors? Again, not knowing the context of it. I know I said don't bundle with snacks, but for many kiddos with ADHD who are on medication, they're often toward the end of the day getting tired. So thinking about kind of the time of day and sequencing, and is this the best time? And then potentially, rewarding, certainly with praise, eye contact, physical contact, successful transitions when they happen, and then again, when the iron is cool, coming back and hey, we all feel like this isn't going so well, sometimes practicing to kind of start that behavior and know what that looks like, then they've had a chance, it's more likely it's going to happen again. And then that, you can remind them and you have something to reward. Those are some thoughts. Yeah, I'm sure there's more. Dr. Leger, I don't know if you have anything that you want to add.
I guess the one, I know there might be other questions and I want to be thoughtful about time, but I think that being thoughtful about what your kiddo is bringing, or your child is bringing to the table. And so a child with ADHD might have, certain strengths and certain challenges, then they might need a different type of, let's say, than another child. And so being really thoughtful about that and finding what works best for your kid, I think, is also another component.
Great, thank you. Another question is, let's Here, my child tells me that playing online games are the times she can spend time with her friends playing together, and just your thoughts on that.
Yeah, maybe I'll kind of jump in first and definitely understand that. That's a very typical response that I hear from a lot of children and adolescents, especially with shelter in place and online learning. Children aren't getting the same type of social interactions that they were getting before. And I hope one thing that came through in this presentation is really how important social interactions are, both within the family, but also for children to have social engagement with their peers. And so I think it ends up being a part of finding the balance. And so are they able to get that social interaction, and is it kind of developmentally appropriate? However, when is it maybe crossing the line and starting to affect eating regular meals or sleeping appropriately, which is so important for mood and energy and all these other factors. And so recognizing that in this pandemic, there are different ways that children are going to use, social media or digital media, and that can definitely be one of them. And there's an important part for it to play, but really looking at it in terms of the overall balance.
Thank you. Another question is, we've been using a technique of, if you do your schoolwork and chores, then you can have screen time, and just thoughts on that and whether or not this is a useful technique from your perspectives.
I mean, I'll just say, I think that can work really well sometimes. And, the proof's in the pudding for your family. I think the nice thing about that is keeps it boundaried. And as Dr. Leger was saying, kind of keeping things in their buckets so that we have time for everything. It also keeps the reward it makes the reward contingent on the behavior that you want to see and the healthy protective factors again. I think depending on your child, some kids, it just ends up being too long to wait. And there's no kind of answer about that other than to say, for younger kids, they tend to need shorter chunks. And so some will need breaks interspersed, and that's just the way it is. And then some really get into like saving up the tokens, and some really don't. So again, I think, in general, we think if you can have the reward shortly after and sort of, again, pair them together in time, that tends to be more reinforcing. So I think it can work really well. But if it's not, certainly there are things that can be done to troubleshoot and try to adjust.
Mm-hmm. Thank you. And maybe just one more. Let's see. I've been working from home and will put on Paw Patrol so I can get some work done. I'm worried what this might be doing to my kid.
Yeah, absolutely. I'm going to kind of jump right in there. It's another one that I've heard a ton with the families over the pandemic. Dr. Leikauf really did a great job of giving, asking everyone to give themselves permission to really understand and respect what's going on. This is a massive stressor for everyone, and everybody's under kind of a lot of different demands or have a lot of different demands and their different needs that are going on. And so I think firstly, again, is giving yourself permission, realizing that this is a unique situation and we have to be thoughtful about kind of a hierarchy of needs. Making sure they're financially stable is really important. And so that has to be something that we think about and recognize as part of the overall picture. And if getting your work done and being engaged and making sure that you have a job and can be financially stable, that needs to also be important. And in terms of just kind of overall, another thing that can be important is really thinking about, if you find it's something that's happening a lot and it's something that you maybe want to think about more, is seeing if there's other supports in your community or other caregivers that can help out for those maybe chunks of time where you have extra work to do at the end of the day, or what can look like, and thinking about your bigger network of what might be useful.
Thank you. All right. Well, thank you so much to both of you again for this wonderful presentation. Thank you everyone for joining us. And please take care. Please also visit our Stanford Parenting Center website if you'd like to revisit any of the webinars, and there are also additional parenting resources as well. Okay, take care.
Thank you.
Thank you.